Welcome my friends. I'm going to share with you my second part of the remedies for common ailments, acidity. I shared with you the first 5 in my first video, and here are the next 5 for the common ailments to help you overcome the acute acidity. My number 6 in this list is another superb remedy which I've used with very good results is natrum phos. Natrum phos is a commonly used remedy, but again you have to understand the comparative metromedica here. Whenever you come across cases where there's acidity from too much sugar, from too much sweets, chocolates and sugary foods, that's a typical indication for natrum phos. So again, you see the causation. Carica papaya was milk and meat. Robinia was more flatulent foods, more cabbages. But here in case of natrum phos is more foods which contain lactic acid. So sweets, sugar, milk chocolates, those flare up natrum phos. What are the indications for which you prescribe? So as I shared with you, sweets and lactic acid, foods containing lactic acid, that flares up for natrum phos. Secondly, as I am sharing with you, there's also sourness in natrum phos like Robinia, but it doesn't go to the head like Robinia. It's more sour mouth, sour vomiting. It can be sour stool as well in natrum phos. But what is an interesting indication for natrum phos? You understand with gastric ailments, the tongue is the reflection of the digestive tract. In case of natrum phos, there is a thick, yellow, creamy coating at the roof of the mouth. So thick, yellowish coating at the roof of the mouth, at the tongue, at the roof of the tongue, which is important. So at the base of the tongue, there can be a yellowish, creamy coating, or even at the roof of the mouth, which is an indication for natrum phos. So look for the etiology, look for the tongue, and also there is sourness, which can be a common ailment with the acidity symptoms. You can use natrum phos as tissue salt, 6x, but you can use it in 30C, 200C, if you have a good picture of either natrum constitution or few phosphorus symptoms as well. Natrum phos is a good remedy to prescribe. My friends, number 7, so just finishing on natrum phos, number 6, as I shared with you, sweets and lactic acid is an etiology, thick, creamy coating on the tongue is a factor, and there's also sourness which is important for natrum phos. So these are few indications for prescribing natrum phos. Number 7 in this list, another very useful remedy to prescribe, and this is a not so commonly used remedy, and I want you to try this please. Number 7 in this list is Embellica officinalis. Embellica, Embellica officinalis. Embellica is another very interesting remedy which is prescribed with very good results, especially when you come across cases of milk intolerance. So whenever they take in any milk or milk products and that is causing vomiting, that is causing diarrheic symptoms, or that is causing a lot of reflux, this could be butter, could be cheese, could be cottage cheese, and that is causing gastric symptoms, that is causing sourness, you can think of Embellica officinalis. I've used it with good results in cases where I had prescribed a MAC carb, where I had prescribed lycopodium, and that is not helping, especially with MAC carb constitutions. You know MAC carb has a sourness of discharges. You know MAC carb has a milk intolerance. So MAC carb is not working with acute or with chronic acidity. You can think of Embellica to overcome the acute situation. Embellica works well in tincture and 6C. Milk intolerance is quite important. Again, the difference with Carica papaya is more milk and meat, whereas here is more milk and milk products, resulting in sourness, sour mouth, sour vomiting, sour discharges. That is quite classical for Embellica officinalis, which is an interesting remedy. Tincture or 6C. Whenever using it in tincture, you can use 10 drops in a cup of water, 6 to 8 hourly. Ask the patient, do not take the conventional medicine. Try taking Embellica instead. Give the power in the patient's own hands, so that you can see light at the end of the tunnel. They have been on PPIs for years, and you can withdraw that with these wonderful lesser-known organopathics. Similarly, in the Western world, use 6C. Ask the patient, whenever you feel you need an antacid, throw it out the window. Try Embellica officinalis. Try it in 6C, 2 globules in a cup of water, 6 to 8 hourly. You stop when you improve. Number 8 in this list, my friends, another wonderful remedy with very good results is lactic acid. You have to understand with any acid, I shared with you sulfuric acid in my first video, where it was more debility and sourness. But in lactic acid, one of the interesting things, with any acidity patient, you'll find commonly that they don't like to eat. But with lactic acid, that's the peculiarity. There is nausea, there is morning sickness, there is a lot of acidity, but whenever I eat, I always feel better. That's very, very, very classical for lactic acid. Nausea better by eating, acid reflux which is better by eating. One of the factors for prescribing organopathics, and this has been mentioned by Herring, who mentions that it's like a three-legged stool. A stool cannot stand on two legs, it needs three legs to stand upon. Similarly, for a lesson on organopathic, you need at least 3 symptoms to make a totality. For lactic acid, on top of the triangle, you find nausea, reflux, better by eating. Second side, there's a lot of rheumatic pains in case of lactic acid. And with lactic acid, the rheumatic pains like bryonia, aggravation motion, better from rest. Remember, lactic acid and bryonia antidote each other, but they're also similar with symptoms. In case of lactic acid, you have the aggravation motion, better by rest. And the third side, since they're better by eating, there's a voracious appetite in case of lactic acid as well. So they're always inclined to eat more and more and more and more. So voracious appetite with better by eating, with rheumatic pains, worse from movement, better from rest. And again, very close to lobelia inflata, if I recall, I shared with you. In lobelia, there is reflux, there is salivation. Similarly, in case of lactic acid, there is also salivation and water brush as well. So 2 remedies which you come across which have profuse salivation with acidity is lobelia inflata, but there you have gastric headache, there you have dyspnea of gastric origin. But in case of lactic acid, whenever there is a reflux, there is a lot of salivation. But at the same time, you have the rheumatic pains, you have the better by eating, and you have the voracious appetite. Very often you can find these symptoms in morning sickness, in diabetes mellitus, as well to prescribe with lactic acid. 1X, 6C are good choice of potency for lactic acid. So if you make a triangle for lactic acid, I shared with you, on top is voracious appetite. Second side, as I shared with you, is better by eating. And the third side, which I shared with you, is rheumatic pains. So those are few classical indications for prescribing lactic acid. My number 9 in this list, my friends, is another fantastic remedy, and I want you to try this, is popular stromoloids. In case of populus, which is interesting, is it's a remedy for reflux, but especially do remember it is for dyspepsia in elderly. So elderly people who are come across with dyspepsia, that is important for prescribing populus trem. And along with that dyspepsia, you can find it's more like burning, it's reflux, but the common factor for prescribing populus trem is the combination of symptoms. With the dyspepsia with populus trem, you can find what is interesting is it's a medicine for UTI as well. So there is a lot of burning in the urinary tract, especially after pregnancy or after delivery, there is UTI. After pregnancy or after delivery, that is urinary tract infections. And thirdly, also do remember you can prescribe it for BHP, benign prostatic hypertrophy, where you will come across cases where there is pain behind the pubis. So more in the urethral region, there is a pain which is classical for populus tremoloids. Dyspepsia in the elderly, which is common. So think of those elderly age groups who are dependent on PPIs, dependent on acidity related medicines, and there is dyspepsia, there is a lot of burning as well. Along with that, there is prostatic involvement. So a remedy like populus trem can address both the areas as an organopathic. It can correct the pain of cystitis, and along with that, any urinary tract infections where there is, especially after pregnancy or after delivery. Wonderful remedy for UTIs. I will discuss another session on UTIs. Populus trem is a fantastic remedy for UTIs which develops, say, after catheterization, after pregnancy, after a cesarean section, after normal delivery, and populus trem is well indicated. Tincture 6C, 30C works in wonderful way for prescribing populus trem. And my last remedy in this list, my friends, is another superb medicine to take care of acidity. And my last medicine in this list is Sinapis alba. Sinapis alba is prepared from white mustard. But interestingly, in Sinapis alba, which is interesting, is there's a lot of obstruction in the throat. So there's a hard sensation, hard body in the throat. There's an obstruction, there's a lump feeling in the throat, which is very, very classical. You can get the burning in the entire tract. So burning is classical, but what is very important is a hard lump in the throat, which is classical for Sinapis alba. Hard lump. Clark says that somebody feels like a hard body or something very hard in the throat. If you feel that here, it is Abies nigra. It's like a lump of egg or a hard-boiled egg in the cardiac end of the stomach. That's Abies nigra. But whenever it's in the throat, you feel something like an obstruction, something like a lump in the throat. That is more with Sinapis alba with an acute acidity. Tincture 6C you can find with Sinapis alba. So smaller remedies, but you see there are innate points of differentiation. With populus strem, there is the burning, but especially in the elderly, you have to understand the combination of symptoms with prosthetic involvement, whereas with Sinapis alba, it's the obstruction, a lump feeling in the throat, which is classical differentiation. My friends, I shared with you 10 remedies. Quick comparison, as I shared with you, was based on etiology. If you see etiology from milk, sugary foods, lactic acid is natrum phos. Milk and meat is Carica papaya. But whenever you think of just milk, it's Embellica. Sometimes you have to look at the sensation. Somebody is telling, I'm feeling shortness of breath after eating. So dyspnea of gastric origin, that's Lobelia. Gastric headache, that's Robinia, that's Lobelia again. But whenever you come across burning in the entire alimentary canal, that's Iris versicolor, as I shared with you. I shared with you remedies which have closely related with the polycrest. Think of Embellica with the sour discharges, with the milk intolerance, that's related with McCarb. With Lycopodium, 4 to 8 pm aggravation, that's closely related with Eagle marmelos. With the dropsy as well, with the bloating in the lower abdomen. So I hope these 10 remedies can help you in your clinical practice for acute acidity related symptoms. Thank you very much for your kind attention. Long live Hahnemann, long live homeopathy.